So here we have another form of specialty that's associated with musculoskeletal pathology, and it's a rheumatologist. These are medical specialists in the treatment of arthritis and other diseases of joints, muscles, and bones. So it's kind of coming at a random point, but we're talking about displacement of joints and things like that, so it kind of fits. Let's learn a little bit about joints. We have a few extra words here that we can teach you about these. Arthro is our term for joint, and that is our general type of combining form that we use. So, you've heard arthritis before. So arthritis, it's inflammation of a joint, so it's arthro with itis on the end of it. We have three types of joints. You don't need to learn those, but they're here and you will learn them eventually. We have diarthrosis. These are freely movable, like in hips and shoulders. We have amphiarthrosis. These are slightly movable joints, typically between vertebrae. And synarthroses. These are immovable joints, as in the sutures of the skull. We think of the skull as one bone, but actually all those little kind of lines that connect the skull, those are all separate bones that kind of come together. And once again, you'll learn those in anatomy. Some of the words associated with arthro are arthropathy. Arthropathy is a disease of the joint. Arthroplasty is a surgical repair of a joint. Arthralgia is pain in a joint. An arthroscope is an instrument used to examine a joint. Arthroscopy is the visual examination of a joint. And arthrocentesis is a surgical puncture of a joint to remove fluid. Remember, centesis, always a surgical puncture. We also have another term that talks about the condition of a joint, ankylo, which is talking about stiffness or being fixed. So ankylosis, stiffening or immobility of a joint. This usually is the result of disease, trauma, surgery, or bone fusion. This could be medically induced. It could happen on its own. Ankylosing spondylitis. This is going to look a little bit like the spondylolisthesis we talked about earlier. This is the actual stiffening of the joint, secondary to chronic inflammation. It's usually an unknown etiology, or in other words, a disease of unknown origin. Always affects the spine. It's characterized by fusion and loss of mobility of two or more vertebrae. Treatment are NSAIDs. So these are like ibuprofen, Celebrex. They're non-steroidal anti-inflammatory drugs. So, and by steroids, we mean the type of steroids that reduce inflammation, not the type you use to build muscle mass. Those are anabolic steroids. We're talking about corticosteroids here. And so that's the baseline. They start with anti-inflammatory drugs, NSAIDs, once again, non-steroidal anti-inflammatories. If that doesn't work, surgery in the more advanced cases. And so when these bones bind together, sometimes they have to be broken apart. And that would be arthrochalasia. Chalasia, the suffix meaning to break. So a surgical breaking of an ankylosed joint to allow the joint to move again. That can be done sometimes. If it's not too advanced, you can just sort of clean it up a little bit, use some arthroscopy. They go in and look at it, take out some of the bone mass, and sometimes they can restore that joint to normal function or close to it. And sometimes you need to bind bones together. Let's say you have a horrible spinal fracture of 3 or 4 vertebrae in the neck, and there's no way they're going to be able to surgically reconstruct it. They're going to create a form of arthrodesis, and this is going to be a surgical fixation of a joint to promote bone fusion. So to promote bone fusion, and in some cases, I've been told by orthopedists, they can go in and remove that hardware after a certain point in time. In most cases I'm familiar with, that hardware goes in and never comes out. Once again, arthro meaning joint. So arthritis, I mentioned a moment ago, that's just putting itis on the end of arthro, inflammation of the joint. Osteoarthritis is inflammation of the bones and joints. And osteoarthropathy is a disease of the bones and joints. So that's talking about the general condition. So both of these would be considered osteoarthropathies. Osteoarthritis is particularly bones and joints, and arthritis is the joints themselves. So that's just kind of a breakdown of how we distinguish and talk about those words. We also have something called RA. This is rheumatoid arthritis. This photograph here depicts it very well. This is chronic systemic inflammatory disease of the joints. Once again, unknown etiology, or another way of saying that is unknown cause. A little over 2 million Americans have RA as of a few years ago. It's probably about the same right now. It could be the immune system attacking the body itself. So we've talked before about autoimmune disease. So the theory is, at least at the time the slide was made, that it could be an autoimmune disease. Given the way it behaves, it wouldn't surprise me that it actually was. Sometimes it's a rapid onset, but usually it's a very slow onset over time, and it causes immobility of joints, in other words, ankylosis, and it causes visible deformities and total immobility in its latter stages. So this is not your classic arthritis that we normally see where the joints get stiff, and as we saw on the slide before that, there is some deformity to it. I'm going to move back up to that slide for just a moment. This is more like rheumatoid arthritis here on the right. In fact, that's how they depict it. So here the bones are become misshapen, joints start getting bent out of place, and things are not normal, versus your kind of garden variety osteoarthritis, where everything pretty much looks the same. It's just those joints get calcified and harder to move. So two very distinct types of pathologies, this one being the far more painful, as you can see in this picture, and that deformity will just increase as the patient moves through time. So it's a chronic disease that they're just going to carry with them. Then we have joints which also can be dislocated or subluxed. So a dislocation is displacement of a bone from a joint. So you've probably heard of dislocated shoulders, sometimes dislocated knees or ankles. A little bit less likely with an ankle, but it's possible. So dislocation is a displacement of the bone from the joint completely. Subluxation is an incomplete or partial dislocation. That's more common in the illustration here, like say the kneecap. The outline shows you where the kneecap's supposed to be, but that's where it is now because it got pushed to the side and it's subluxed, so it's not coming back to where it should be. Both of these, if they're not too severe, can be fixed, very quickly if one knows what they're doing. Of course, medical professional knows what they're doing. They usually don't require extensive workups. Sometimes it's a little bit more extensive. My experience is limited, but I've never seen one go to surgery. I won't say it's not possible. I've just never heard of a subluxation or dislocation being surgical, but it probably could be. And of course, we have our fractures, which are abbreviated FX, and this is the cracking or breaking of a hard object or material. Yeah, like as in a bone. So most people have broken at least one bone in their body, sometimes not, and that's great. There's all different types of fractures. We're not going to go over what they are. You will learn these in pathological medicine if you deal with orthopedics. You'll learn the different types of fractures. You're welcome to study and learn them if you'd like, and we have a slide here that shows you and describes to you what they are. It doesn't have any illustrations, but you can look them up online if you want. I'm not going to test you on any of these because we're not doing pathology in this class. We're just learning the words. But there you are. There's the words. If you want to study them and learn them, you may do so. That's everything we have for you for the musculoskeletal system. So that finishes our lecture for Chapter 10. So go ahead and get your studying going on. Keep up the hard work. You're doing great. We're getting close to the end of the semester. And very soon here, within the next week or so, we're going to start talking about prepping for finals. And I have some surprises for you in terms of extra credit and a chance to get extra points and make up for maybe some of those points you might have lost over the semester. So we'll get into all of that within the next week or two. For now, just have a good time studying your muscles and bones, and the exam will be posted this weekend. And as always, any questions, please let me know. Thanks.